Elias Munshya here on TVBAKWETU. Good evening, Chuempala. We were having a very nice show, and then for some reason, we got cut out. We don't know what happened. Maybe Katuishi. Somewhere, somehow, we couldn't continue. But here we are, TVBAKWETU, and we are with our resident pharmacist, who is also TVBAKWETU Director, Jerome Kanika, and we have Mr. Mapanza Nkwilimba, and we have Mr. Mukelabai, and what we are discussing today is whatever is happening at Ministry of Health and drugs, the issue of drugs in hospitals. I've already sent you the link that you can use if you want to join us today, because I want to keep Jerome focused. Jerome has so much data that you need to focus him for you to get the data that he has. And so we're going to do that for a few minutes, and then we're going to call it a day. You were explaining something on the previous show, but we'll see. We'll see how it goes. Now, the issue is what should be done to just shorten this tender, whatever it is, that must be done by the Zambia Procurement Agency.
Okay. You see, Munshya, one thing that you need to know is if nothing can be done in the next 30 days, we are going to enter into a crisis concerning the medication. Because as much as the hospitals have been given the grants to buy the medication, they need to supplement what ZAMSA gives them. So ZAMSA is a bulk buyer, and they buy then distribute to hospitals, and hospitals now using the government grants, they get what from the grant, they get some money to supplement what has been not been delivered by ZAMSA. So in this situation where I've said that the stock are low, what is needed is for us to procure these medication as soon as possible. And in this situation, government entities that's supposed to get involved in making sure that these contracts are done or these tenders are floated are supposed to campaign as a means of health and make sure that they work with the ministry to make sure that the contracts or the tenders are done as soon as possible to alleviate, you see, the pending crisis concerning the medication. What we currently have, we have the stock for just 30 days. So we need to make sure that we put everything possible to make sure that within 30 days, the drugs are in our facilities. Without that, we have a big problem. But let me also rush to mention here that the good thing that I'm happy about is we are going to start receiving very soon, but though it will take some time, but very soon, the health center kit that contains the medication that we have been getting or giving health centers. And in this situation, most of the health center kits we were getting from Mission Pharma, and Mission Pharma is back and is here bringing or giving the drugs to the Zambian people. Now, for them to have a first consignment of the medication, we need to wait for, if they do it quicker, it's within 3 months. After 3 months, if they don't do quicker, then we need to wait for a good 6 months. But those tender contracts and that have been signed. So that itself shows you to say how much people need to prepare. So in this, but once we start, the first consignment of drugs come from Mission Pharma, it will be a continuous flow of medication. And I'm very much worried in terms of our storage capacities. We may have built ZAMSA storage facilities.
What is Mission Pharma?
Mission Pharma, it is a company that have been supplying health center kits that was frustrated by the previous government after them demanded that they are paid for the money.
Mission Pharma? Is it
Mission Pharma? Mission Pharma, it is based in Denmark, where we also have a Mission Pharma in Zambia, Mission Pharma Zambia. But
you created major. I need to focus. You said 3 categories of companies: citizens-owned companies, local companies, and international companies that have partners with citizen company. What company is Mission Pharma?
Mission Pharma, it is an international company that have partnered with a citizen-owned company, which is called Ngasa.
Okay, and so what you're saying is that it will be supplying health kits now.
Yeah, health center. What is happening when you talk about the NB issue? We talk about the drugs that are contained in the health center kits, and in this situation, Mission Pharma, which is an international company which has partnered, it's a citizen-owned company, Ngasa Pharmaceuticals. They are now like bringing. They should be the one now bringing those health center kits into this country. You see, and once we start receiving these health center kits, because it's a huge consignment of health center kits, it will be a continuous process, and this will alleviate the shortages which may happen in health centers, because these health center kits are tailored to the needs of that particular health facility.
All right, thank you. Thank you, Jerome. Patricia Tembo.
Hello.
Hello, Patricia Tembo.
Hi there.
You're live on TVBAKWETU. Elias Munshya here with Jerome and Mr. Mapanza Nkwilimba.
Hello.
Yes, we can hear you.
My sound doesn't seem to be very good. Hi.
Oh, hi. Yes, we are on drugs and ZAMSA and stuff and health in Zambia. What's your comment?
I think it's been a very, very long outstanding issue, and something needs to be done. because I think you might as well not even give people prescriptions because there's never any medication.
Okay,
And
that's
so,
understandable. Are you okay with the solutions that are being proposed right now by Mr. Kanika? We know there is a problem. That much we know.
anyway, I'm going to be very, very sincere. I didn't kind of get all of it. I'm kind of cooking and listening in. So nombala alaposa kwama nonala kutiko kufikapo. Then I'll comment.
Yeah, okay, we'll see you tomorrow. Thank you very much. Jacqueline Chishimba. Bachishimba wesu.
Mkwai ba Munshya chungulopo mkwai kachinga kachero uko kacherepo mkwai.
ZPPA na ZAMSA.
Jerome, how are you?
How trivia we know ba Jacqueline, how are you kwena?
I'm fine, thank you. Mr. Mapanza, how are you, sir?
I'm doing very well, madam. How are you doing?
I'm fine, thank you.
Areni, ZPPA and ZAMSA, what should happen?
I think my contribution in that area is simply that, look, whatever solutions they come up with, the most important person in there is a Zambian. And I just want to make it very clear that, look, when we sit in positions of power and influence, we should not forget why we are there. When we sit on boards, when we sit in all these regulatory institutions, we should not forget why we are there. I think as a people, we have a tendency to forget quickly. Ngande fue nchito, delanda pabantu. Ngamwaisa mpele nchito, na alaba abantu. So ZPPA, ZAMSA, who is our target? Who are we saving? It's the Zambians that need drugs, that need the health services, that need the privileges to a good health across all kinds of Zambians, regardless of tribe, age, color, region. So I think for me, what is important right now is that even institutions such as the SCC and the DEC should take interest in the decisions that ZAMSA and ZPP are going to make. We are tired, 50-something plus years after independence, of people making decisions that satisfy them and their companies and their friends. But I think right now what we want to see are decisions that will impact our people. I want to go to UTH. I'm paying my insurance through NEMA. Okay, so if I go to UTH, why should I be given a prescription to go and buy my drugs from a nearby pharmaceutical owned by a doctor who is in the university teaching hospital? I mean, look, guys, let's just be serious around these issues. And I think the president has been clear around some of these issues. The Minister of Health is clear. And it's just up to us as individuals and all those sitting in these areas and these institutions of authority to make the right decisions. Okay. And we can't beat about the bush. And Jerome, if people don't do the right thing, call them out like you've done before. Even if they are colleagues, they are friends, call them out. Because abantu balefwa, when umuteko uli, because some greedy fella has decided to be funny. And when passing policy, people sit in a comfortable chair in a boardroom and make a comfortable decision to feed themselves. Munshya, I'm ready to take questions.
The thing is, we are 10 months. Drug supply daireumfuika. There is something wrong with it. 10 months down the line. Now, Munshya, we've scored a lot of good things, and I think we commend the government indeed for a lot of positive things that have happened. But over the drug thing,
I saw a news item either Monday or last week, Thursday or Friday on ZNBC, where some women went to a hospital, was at Bauleni or Matero, and they were a bit happy that they were able to be given drugs that in the last 4 years they've always been given prescriptions to go and buy somewhere else, Pynam antibiotics and whatever else it was. And they said, we are happy that we're able to be given this, and we haven't had this in, I think, 4 to 5 years back, which for me is a good thing. Now, when you ask me about ZAMSA and you ask me about ZPPA, okay, and I'm speaking as a woman who has experienced certain issues coming out of ZAMSA and coming out of ZPPA, and this is why I'm emphasizing that it's important that when these two institutions sit, whether to make policy or regulations or mechanisms of how medicines will flow into our health institutions, can people have in mind our local people? Can they have in mind that grandmother, that grandfather, that child deep in Kaputa, in Chelenge, in Mwandi, who only needed trotuma pills 6 to be healed and have a life until they are 70? Because in this country, people die when they're not supposed to die. That is what I'm emphasizing, Munshya. And these are not issues we're going to beat about the bush when it comes to medicines. Tuanakanabe emiti, tuanakanaba pangama regulations around medicines that allow medicines to be siphoned out of hospitals. And if nothing is done, one day Zambians will hold you and I, who are leaders in our own right, accountable. Because and everyone thinks no, you and I, like Jerome has done and yourselves so many years now, we have to talk about these things.
Okay. So anyway, there has to be a tender, and we are appealing to both entities to quickly look into this tender and not waste time.
And that tender should be transparent. We don't want to see people who tendered in the past use a certain company to come and bid and shani and money exchange hands. We know what we are talking about. One, we are not young. Two, we are exposed. Three, we are learned. Four, we understand the systems. And five, we've got colleagues like Jerome who are in the system.
Yeah, so Jerome says that, first of all, a citizen-owned company. Secondly, it's a local company. And thirdly, it's an international company. So, and Jerome says that citizens-owned companies, they have the capacity to be able to supply all these drugs.
Yes.
And
so
I think we hope that that is going to be implemented as quickly as possible so that we can have drugs. Otherwise, we need drugs.
Yes, and the other thing, Munshya, that should be made clear, if my company is a citizen-owned company and I'm able to supply and I bid in and I meet all the requirements, and somebody comes and knocks on my door and says, 10%, can I blow the whistle, please?
Yes.
Because I think that's important. Because Abama international companies, Bamo, half the time they got the tenders to supply drugs because and even many times would have even dubious international companies supply us expired drugs. Jerome knows I'm not lying. So if it's a local citizen and citizen-owned company, can they just write a letter even to SCC and DEC and say, issue ni, baba chitana record? People, we are tired. Let's develop the nation. Thank you.
Thank you. Ms. Nkwilimba.
Munshya, before Nkwilimba comes in, though it's like he has too many accounts here. Before he comes in, I think the point that has been raised by Madam Jacqueline, I think are very much valid points. No wonder, currently, we need, as all the Zambians, to support the current Minister for Health. Because She's for the agenda of pushing the Zambian or the citizen-owned companies having coming on the table for them to supply the medication because they have shown capacity. So if we have some, you see, this also starts with the type of minister you have. If you have a minister who wants to get some corruption, who wants to be corrupted, then you are going to have a problem. But we have a minister who have refused to go to bed with the corrupt suppliers of drugs. We cannot say we don't have corrupt suppliers. We have corrupt suppliers of drugs. They corrupt you, then instead of only ending and corrupting you, they are going to also bring fake drugs to the Zambian people. All those things are documented, and we have enough proof to even most of them to even blacklist it for them supplying fake drugs to the Zambian people. But they are not blacklisted because they bribed some people in some of these institutions. So we need all of us to support the current Minister for Health, whom we have, because she wants to push that agenda of making sure that the Zambian people are being put as a priority as compared to the foreigners.
All right. Okay, I think that's very clear. Mr. Nkwilimba, are you there?
I am here, Doc. Yeah, I think what I'd like to say is that what we need are medicines, drugs in hospitals. 10 months in government is long enough to resolve the issues of inadequate medicines in hospitals. If the UPND was ready to be in government from day one, we have had enough time in 10 months to resolve whatever issues were there before. We kept blaming PF when we have been in government for 10 months. Whichever way we discuss this, we could have done much better than we have done so far. You're talking about positions. Who runs the ZAMSA? Should it be a doctor? Should it be a pharmacist? What you need there is a person who is experienced in procurement and supply chain management. Whether that person is yes, this is an issue of supply. It's an issue of procurement. It's not an issue of being a pharmacist. Being a pharmacist is an advantage, but if you have a pharmacist there, that being a pharmacist is not enough to manage the procurement and the supply chain management of medicines. Jerome, I know that you are a pharmacist and you would rather see a pharmacist there. It's okay to have a pharmacist, but that pharmacist should have extra experience. They need experience in procurement and supply management. Pharmacy alone is not adequate. So that's what I can say. We needed to do something. We cannot talk about ZPPA. ZPPA is a procurement agency. I mean, it's a police agency. It's not just looking at the procurement of drugs and medicines. It's looking at the whole policy in procurement. So yes, if there is an emergency, and in fact, this is where if there are no drugs consistently in a country, the government should declare an emergency, so that you can set in a mechanism that will help to move things quicker, so that instead of having a long period of procuring these drugs, they can be procured in a short time. And you see, I think that the UPND has goodwill from our cooperating partners. If really we had the challenge, maybe money is not a challenge, but if money was a challenge, this could have been resolved, by taking advantage of the goodwill that this government has with cooperating partners. There's no excuse whatsoever not to have Panadols in hospitals.
Is it at this point that the Minister of Health should take political responsibility for this? Or you still give a little more time?
For me, really, this is the time that the minister should take a political decision. You know, we cannot keep complaining about circumstances surrounding this when we could do better.
Yeah.
For me, really, I would encourage her to take a political decision.
All right.
You know, but in taking a political decision, she must understand exactly where are the bottlenecks, and face those bottlenecks head on, instead of skipping around the bottlenecks.
Okay. Okay, Nchimunya, I want to bring you on. So it appears like you have said some things at mine. Can you get me now?
Can you get me now? Yes, I can get you. Yes, I can get you.
We're getting an echo.
You are. I don't know, but I think. Let me do this. Okay, are you getting an echo?
Okay, I think the echo has disappeared. Yeah.
Bluetooth AUX mode.
Okay, yeah, sorry for that. Yeah, are you getting the echo still?
The echo has disappeared.
Great.
No, it's back. No, back. It disappeared and then it's back.
Huh. You know, I'm using the phone, so. Okay, maybe. What about here?
Okay. Okay. No, we're still are getting. So you did something that.
Okay.
That disappeared. You need to switch.
You need to switch off. Switch off some gadgets.
Yes, you need to switch off some gadgets.
Are you still getting the echo?
Okay, so unless I speak,
all right.
There's still.
Okay. I don't know.
Go ahead.
Okay. Yeah. So, thank you so much, Dr. Munshya, for the opportunity that finally I've featured on this program. First and foremost, I'm a former employee of now ZAMSA, then it used to be called medical stores. And my responsibility were directly involved in managing the stock medicine. But I think what I would want to tell you is that the problem with ZAMSA started when the minister then, Dr. Chirufya, thought the only people who can manage the institution in terms of managing stock and distribution of medicines to health facility, it was only pharmacists. That was the biggest problem. I am not a pharmacist. I'm a procurement specialist. And most of the critical staff we had were not pharmacists, but we never had drug shortages in the hospitals. We never had delays in distribution of medicines. We never had delays in managing the procurement of drugs. Now, pharmacists are not procurement specialists to understand the act 100%. We need them in issues to do with the quantification and the management of the efficacy of medicines. But in terms of managing the procurement and storage, warehousing, and distribution, it's not something that they should be put at the center of that institution. Yes, I have worked with Nalishewo, who is now the acting DG. I've worked with Vieni Nene, who is now the acting director logistics. Nene is a qualified procurement specialist who has good credentials in a pharmacy. But now Dr. Chirufya decided to put the entire management system, pharmacists, which is the biggest problem. And this is why we have this situation at the moment. They decided to remove all the people who are qualified, including myself, because they were being called Tongas. Anyway, I don't want to go there. But looking at, I agree with Jerome, where he said, we have the provisions in the Act, which medical stores or now ZAMSA can apply by way of reducing, maybe giving a waiver in the manner procurement is managed by ZPPA. We have those provisions in the Act. Why is it that medical stores, now ZAMSA, is not applying these sections in the Act? Why should we prolong the process of procurement for life-saving, medicine? That's the question that we should be asking. All these things are there. But again, what the problem is, I think, you remember there was an issue of procurement specialists being fired at the Ministry of Health. That was maybe a whip to silence or to threaten the profession. And everyone in the country now who are involved in the public procurement, they are failing even to make decisions because they feel 2-3 years later, these issues will come back. But we are talking about saving life in the hospitals, having these medicines and medical supplies available in the public facilities. But now, what needs to be done is, number one, is to engage ZPPA, to remove all these useless, the circulars flowing all over, delaying the procurement procedures. On medicines, they should just give a waiver and make sure that the procurement systems are streamlined. We cannot go for 4 weeks of advert. Why should you advertise for an advert to run for 4 weeks? Why should you have an advert to run for 6 weeks on medicines? When you have hospitals without medicines, we can't do that. It is just a matter of someone taking up the responsibility to write a letter to ZPPA to request for them to give them a waiver to run an advert for 4 days, 5 days. They shortlist and they award. As simple as that. It does not. All you need is the approval of the local procurement committee. You don't need to get an approval from ZPPA. And you're also expecting the government also to look at the issue of importation permit of medicines, because there is a problem. Okay? On medicine, I saw, I read a certain article where they have reduced the procedures on the importation of trucks with the cooling systems. Why can't they apply the same method on medicines? Why should we have all these permits all over for a local supplier? We don't need that. So on medicine, we need waivers, and it requires just one individual, somebody, to write to the government, write to ZPPA to remove this act which we are using now. Has a lot of problems, and it has caused a lot of. I was at where I'm working from. It's just about 500 meters to ZAMSA. I was there this afternoon. I spoke to the acting director of procurement. Okay, people are working with fear because they don't know what is going to happen after 2 years from now. You understand? So all we need is someone to write a letter. I was fired. I was removed from medical stores because they said, no, these are procurement people. We need a pharmacist. We need pharmacists, yes. But in terms of managing warehousing, in terms of managing procurement, we need procurement people to manage the supply chain system.
All right, thank you.
Thank you.
Thank you, Chimune. Okay, I'm going to mute you. We're going to be talking to you. I think you've explained a few points that are very, very important, but we need to listen a little bit to our sponsor, and then we are going to come back in about a minute or so.
Has it ever happened to you while you abroad? You send some money for your project, and they take advantage of the situation for their own purpose. Now we are your solution. If you buy land, we will check for you. No matter how far you are, we make it happen for you. Panama, you send it to Baghdad, you send it to London, Pagashi. it happen for you. Airs global, airs global, airs global. We make it happen for you. Do you want inspection? Airs global. Documentation? Airs global. Do you have a funeral? Maybe a wedding? Airs global.
Check us out at www.airsglobal.com. Airs Global, we got you covered.
Airs Global.
Thank you. Thank you very much for joining us once more. Dr. Kajila.
Yes, Munshya, how are you?
Very well. Go at it.
Yeah. No, I'll dive in straight away. Greetings to everyone. I've been listening very intently to this very, very important discussion. And I thank Jerome for coming out undeservedly offering his opinions and his knowledge on what's happening on the ground. And I also appreciate what Chimunya's input has been, because clearly this is a person who's also been involved in the procurement within Zambia. So I think these two people are very important to our discussion. I'm not a specialist in procurement and all that, but I want to make a few comments. So first of all, I want to agree with Kwilimba about the importance of medication in our healthcare system. This is not an issue we can play with or delay, because delaying in providing medication to our patients is really a crisis. It's going to result in people dying unnecessarily. So because of that, this issue cannot be dealt with kid gloves. This issue is important, and it has to be attended to with the importance it deserves. So I do quite understand the challenges that the ministry has had, and particularly the Ministry of Health, in taking over a ministry that was fraught with a lot of corruption and things that were happening. So coming in and trying to clean the place, sweep the place with a broom is an important part. But I think what probably was missing is while cleaning that broom, you need to still maintain the systems that have been in place for the past 60 years to continue functioning while cleaning the broom. So in other words, the delay, like the moratorium on ordering of drugs or whatever was done in the very early phase, that in itself created a bottleneck. And sometimes it's very hard to recover from that because you are playing catch up. So that's in retrospect, but I like solutions rather than and just focusing on the problem. One of the solutions, in order for our the audience to understand this system better, Jerome, I would suggest if you had presented a PowerPoint presentation of the kind of model of drug procurement, distribution, and storage that Zambia has adopted. And then in that model, showing where the policy comes in, if it's ZPPA, where ZAMSA comes in, where the pharmacists come in, where the patient comes in, where the hospital, the ministry, the finance, and then pinpoint the areas where there have been problems. Once we have that visual, it would be easier for us then to say, okay, what are the immediate solutions we can offer in this problem? The issue, I like the idea of starting with citizens, local companies, and so on. But sometimes in an emergency, you need to look outside first while you're sorting out the local priority. If there's a crisis, go for the solution. If the solution means hiring a company from outside that can fill in the void until the capacity of Zambian companies is such that adequate to provide all the needs of the drugs that are available, then at that point you can really make sure that policy starts being implemented. But it can be done in phases rather than in a crisis situation, you're going that way. But having said that, I really appreciate what the government is trying to do by empowering Zambian companies. Those of us in diaspora, particularly on drug shortages, we are working hard to look for good, plausible, and good sources of drugs for our people in Zambia. And we want a transparent process, and we want to create companies that can actually do a good job by partnering with our brothers and sisters on the ground. So I just wanted to make that point. Thank you.
You know, Dr. Kajila, I don't know whether that is obtaining in our parts of the world. Apparently, the Zambian government can't just go to an industry, to a factory, and procure drugs. I didn't know that. Apparently, we can't do that.
That's interesting. In fact, you've reminded me, Munshya, on one question that I wanted to present to Jerome. Out here in Canada, drug companies, the government has realized that because we have a universal health care, so most drugs are supplied free, of charge, especially if you're an inpatient. They realize that it's too costly on the government. So they are now going for generic drugs. So there are companies that have been allowed or promoted to be created that provide cheap drugs, not the drug company drugs like Pfizer. So if Pfizer, say, produces Coverstib, you have an alternative, cheaper company producing generics. I just found that
interesting, Pfizer. Mm.
Exactly. So those generics would then they have the ingredient of the actual drug, and they actually work, but they are cheaper. So I'm not sure what the system is, Jerome. Can you feed us in terms of sources of drug procurement? Why can't government buy straight from private entities? I've looked at a few models in the world. WHO has a model that they promote for developing countries, but some developing countries are tweaking it to suit their needs, their people's needs.
Now, before Jerome answers, apparently it's because drug manufacturers don't want to deal with government as well. So government doesn't want to deal with manufacturers directly, but also manufacturers themselves. They don't want to deal with governments.
But the manufacturers do deal with middlemen. So
yes, they would rather deal with middlemen. It's a financing issue.
Yes. So if you're dealing with a middleman who then is a wholesaler, buys directly from the manufacturer, then the wholesaler then can get contracts with governments and other private entities.
Yes, and the problem is the funding. It's the confusion in funding, because governments unfortunately are not good payers, right? So if you're a manufacturing company, you can't take the risk of depending on government to pay you. Otherwise, you run out of business. I think that's what happens to these manufacturing companies all over the world that can't help us. Shimunya, do you agree?
You muted.
Okay. I did not get you. What was your question?
No. The issue of the fact that the Zambian government can't just buy drugs directly from the manufacturers in Egypt or India.
I don't agree to that, and I find it so difficult to still have people who do think that way, because I think this is the reason why we need expertise in this. You know, in the Act, Zambia Public Procurement Act, the Act has provided for international bidding process, international procurement method is there. It caters for international procurement. So why should we not buy direct from the manufacturer?
Jerome?
Yeah. You see, Munshya, to start with, I'm a pharmacist. I have no any other qualification in terms of procurement, but I have a lot of interest in reading. No wonder I'm here to say that when you check in the Public Procurement Act, number 8 of 2020, when you check section 89, subsection H, it clearly states you where the problem is. So in this situation, yeah, the problem that we have in Zambia and the challenge that we have in Africa as a whole is about counterfeit medication. So in terms of Dr. Kazira talking about the issue of generic, everyone is moving generic, but quality generic. But in Zambia, even the generic that we have are substandard generics. That's where the problem is. You say, okay, you cannot afford the branded. You cannot afford the superior molecules. We are going to bring you the generic. And those people, they used to bring the generics that are substandard. And people have made billions and billions of dollars from Zambia by supplying fake substandard generics. And this is where Honorable Masebo has put our foot down to say, look, we don't care whatever, but we want you to bring to us quality medication for the Zambian citizens. And this is where you are having now some fights that are coming here and there to undermine what the minister is trying. But anyway, that's a story for another day. So in terms of generics can be brought in Zambia, what drugs we use in Zambia are generics. We don't mainly use the branded. And the system where we are, how people have put the system, they have put a system to say the branded or those with trading names themselves, they are too expensive for people that they cannot afford, which is not true. The same drugs that are used in Canada are the same drugs that are used in South Africa, are the same drugs that are used in Zimbabwe, and are the same drugs that are used in Namibia. Zimbabwe and Namibia are African countries and they are our neighbors. How they have managed that is something that we need to ask. But in Zambia, the people who have been continuously been supplying fake drugs to the Zambian government have made it in such a way that they continue manipulating the system to continue supplying fake medication that have killed a lot of Zambian people as compared to the diseases themselves. So that's why the issue and
Jerome,
the problem.
Jerome, you realize that's a very big claim.
It's not a big claim, but that's a fact, Munshya. You see, I think Munshya, the fact which is there is that's the fact that Zambia is attacked right, left, center of counterfeit drugs. No wonder some embassies you see them writing to their citizens to say, look, when you're coming to Zambia, you are coming for 3 months, 2 months, come with your drugs packed from the country you are coming from. Why do they put such a thing? Because of the issue concerning how the drugs has been done in this country. So it's not like it's something, an allegation or whatever thing. It's something that is happening on the ground. So we need to do the right thing. And that right thing, in terms of regulation of drugs, it's another thing that we can talk about, and how ZAMSA does and give the issues of market authorization. When it comes to the issue, which I heard Chimunya talking about, cutting what in terms of registration for drugs, one thing that you need to know is in Zambia we have an authority that gives that states to say this drug is okay, can use on the Zambian market, and that authority that we have is ZAMSA. If ZAMSA approves your medication, it is safe for it to use in the Zambian people. But when you test that medication with other laboratories, they found that the medication is fake. The medication is substandard. You can sue ZAMSA. Okay. You can sue ZAMSA. And those incidences, we have such scenarios where a medication is approved by ZAMSA here, but can't even pass or used in another country.
We need a little bit more facts for us to ascertain for sure whether
that's what I'm saying. We had some incidences of such nature. So there is a waiver when the government is procuring. There is a waiver in which the drugs comes, and ZAMSA is a little bit lenient in terms of the way they follow for registration for medication. So in this situation where we are currently at, the procurement that need to happen, that need to go in, it is a procurement of government to government. And in this procurement of government to government, it now requires the president himself to come in and direct all the institutions that are under him to make sure that they do that of government to government. In that situation, all the institutions are protected, and when things come out in the near future, they will be able to say and state exactly to say, we were covered by the president by doing this. If there is no such kind of a thing, that means that the law needs to be followed. And we cannot go against the law. We put this law to govern ourselves. We put this law so that we can build capacity within ourselves, and so that we can give the medication to ourselves accordingly. But if we are not following the law that we put within ourselves, then it will be a big issue, a big problem. So in as much as we are passing through some challenges, we need to respect the law. What is needed is for the entities that are involved in doing the right thing, they should be doing the right thing at the right time. You see? Not waiting for a crisis. In the midst of crisis, there is too much corruption that happens. And that's my fear. And the Ministry of Health has been using this tactic of creating an artificial crisis for them to make money. And this is what they are doing now, is creating an artificial crisis for people to create money, which should not be the case. People should not deliberately create a crisis. When I'm talking about Ministry of Health, I'm talking about even other parastatals that are associated to it. It may not be directly ministry, but even other parastatals that are associated to Ministry of Health. So we need to stop that. Once we stop learning, because people know that shortages of drugs in the country, every media house, they'll start speaking. And as a result, a minister, because they're a politician, they'll succumb to the pressure of the public talking about this issue. As a result, they'll eat. They'll use corruption. They'll get money from other people. They are not supposed to get the money. So we need to do the right thing at the right time. We cannot wait to create artificial crisis. Then we say, no, let's not follow this law. Let's not follow this law. That's unacceptable. We are paid on a monthly basis. Tell me which government institution under Ministry of Health that has stayed for 6 months, 7 months without paying any worker. They do paid on a monthly basis to do the right thing. Why don't they do things on the right time? Why do they deliberately go and make something that is not in the law for them to make sure that they gain some cash from there? These are the real questions that we are supposed to be asking ourselves, in as much as we are talking about shortages of drugs in facilities.
Dr. Munshya, can I come in?
Is he there?
He's not there, so maybe I
just
can
go
come in.
ahead and start.
Yeah, I would like to propose that key stakeholders, have an emergency meeting to resolve this problem. ZAMSA, ZAMRA, ZPPA, and Ministry of Health, they need to come together urgently and deal with this situation and look at all these issues surrounding the shortage of drugs. the issue of fake medicines. Why is ZAMRA there if we can allow fake medicines in the country? I think that when there's if a tender is, there's a tender that has been, what's the term? A tender has been, has been floated. Anybody is free to tender, whether it's the manufacturers in Belgium, manufacturers in Canada, they can tender. As long as it is going to help us to resolve the immediate problem. We need to waive all these issues of it has to be a citizen company to foreign government. It's we can deal with this now. We can deal with this now.
Can you mute yourself, please?
So I think it's critical. Really, we should not be skating around this problem. Let's have all these key stakeholders come together and resolve this. It can be done. The laws have been made by us. The rules have been made by us. And when we have all these important institutions coming together, this problem can be resolved in the earliest possible time. Thank you.
Jerome,
may I come in?
Jerome?
May I say something?
Okay.
I haven't said a thing.
Okay, go ahead.
Sorry about Dr. Kajila.
No problem.
I just wanted to find out where is this news? Is it in the is this information coming from the government or from the propagandist about the shortage of medication in our hospitals? And if it is coming from the propagandist, this is what they would want us to be talking about, and they're getting what they're wishing for. But if it came from the government, I would simply say, we told you so. The government owes the Zambian people an explanation, and we don't even need explanation anymore, because we can't hear, we don't know Tawagache, and many people are going to lose their lives. And they're not going to lose their lives, but we are losing people because of lack of simple medication that is affordable and that we can do because somebody wants to follow the procedure or wants to follow certain rules, or you are waiting for the right person to be in office, or you are waiting for a week, the tender to be exhausted within a week. That is nonsense. To me, you, the government, the people in charge, you are liable for any loss of life that we are going to incur from the time you neglected to supply medication. Zambian people should now actually focus, go straight to Kuma courts and sue for professional negligence. We can sue. We have a cause of action to sue the government or to sue those people who are in charge of giving or supplying medication. Why are we lacking simple commodities in our country when we have the human resource and we have the money, the finances we have for the medication? Unless you are not telling us the truth. If there's no money, say so, than going around beating about the bush. And this system, this message, I'm going to direct this to the New Dawn government. This system of you, gentlemen and ladies in the government, of keeping things to yourselves, just because you are in position to know the status of the economy, and you tend to keep it to yourselves. You don't want to share to the Zambian people for fear known to yourselves. These are the problems that you're going to incur. We are going to come for you and challenge you, or even terminate your contract. Remember, the power is with us. So this issue of drugs shortages in hospitals should not be the issue right now. We should prioritize a human life, not if you're for procurement a procedure. There has to be an emergency, an interim undertaking where you should supply medication.
Right. Thank you. Thank you very much. I think consensus here is that we need to shorten the process, and we need to work together to ensure that drugs are supplied. We're going to continue this conversation sometime. We're already at
communication.
Sorry, Mr. Munshya. Council, Dr. Munshya. One thing clear. The government has gone into a government-to-government procurement for drugs with a country called Egypt. The reason is because they've discovered that that process cuts away these middlemen. And the drugs are genuine. Jerome, you know. And I think that when we have these discussions, people, let's come with facts. Let's not just say there are shortages of drugs in the hospitals, even when we know that for the last 1 week, different media houses in the country have been going around showing how pharmacists in the hospitals, the pharmacies in the hospitals are being stocked up. So unless but from last week effort to Monday, Wednesday, so I think by propagandists and then to government, to our Minister of Finance, to our Minister, who shall procurement mechanism
Yeah.
I'm not saying everything is rosy, but I think let's not come on air without facts, because there are things that have started happening. They are happening. There's red tape that has just been cut in the procurement system.
All right.
And I think we need to talk about that red tape that has been cut and how it will benefit our people, and not to go on about this and that. Let's be very careful. Thank you.
On that point, we're going to come back on this very important topic in the coming days to discuss about some of the new things that have happened in terms of country-to-country supply of the drugs. As Jerome is there laughing, I don't know why he's laughing, but we are going to have a continuous discussion of this. This has been Elias Munshya here, together with our friends on TVBAKWETU. Good night, God bless you, and God bless our country.